Hi, this video is intended to help you navigate through the screen of a Servo U ventilator. What you're looking at in front of you is the normal view you'll see on a Servo U vent in the ICU. On the right side are patient values. Across the bottom are ventilator settings. You have your waveforms in the middle. Our vent mode is up on top there. The alarm silence is in the top left corner, and our 100% FiO2 is in the lower left corner. So for this patient, they're on a volume control mode. Respiratory rate set at 15, tidal volume of 400, 8 of PEEP, and 40% FiO2. The patient values are right over here. Because we're on a test lung for this video, those numbers are going to very closely coincide with what the ventilator is set at. Once you have your peak airway pressure on top there in the orange, right below that is your respiratory rate. The exhale tidal volume, which is reading 407 at the moment, is right below it. And you go over here if you need 100% FiO2 for suctioning, or if your patient is having a brief desaturation. It's on the bottom here. When you push it, you're just going to hold it down for a couple seconds, and then it'll start counting up to that 2 minutes. So it'll give you 100% FiO2 for 2 minutes. And if you look at the top here, the alarm silence button also starts counting down from 2. So you get 2 minutes of alarm silence and 2 minutes of 100% FiO2. If you want to stop that at any point, you can just touch it again. Same with this, you can reset that. If you just need the alarm silence, if you're turning your patient, if they cough and you're just quieting the alarm, you can just push that top left button and it'll silence for 2 minutes. So speaking of alarms, I'm just going to give you an idea of first what it looks like at the vent alarms. We're on silent, so you're not going to hear anything, but this is your peak airway pressure alarm. As you can see, the peak airway pressure number starts blinking. A red light lights up on top of the ventilator, and it says airway pressure high there on the alarm notification bar. If we normalize a little bit, we're just going to have a high respiratory rate, which is going to blink yellow rather than red because it's a less severe alarm. So here I'm just going to unsilence our ventilator so you have an idea of what it actually sounds like. So this is that severe alarm. And then once we relax to just a high respiratory rate, that's the alarm you're going to hear for a less severe alarm. Okay. Once your patient normalizes, you see that everything resets itself. So there's no blinking on top, no blinking by any of our patient values, and there's nothing indicating anything wrong in the alarm notification bar. However, you will see an exclamation point there. So you know the ventilator did alarm at some point, however, the patient is fine now. Respiratory therapy might go in here and just find out what happened and when it happened. So we're just going to X out of there. There are a few other views you might notice with the Servo U, so I'm just going to show you those right now. This is a basic view. Less patient data on the side, but you can see more waveform. Loops. A family view, which just shows your patient data over on the right and your vent settings on the bottom. And a distance view. This view would come in handy if you're monitoring a patient from the hallway. You can better see those values and still have a small peek on those waveforms. So I'm just going to go back to the advanced view because that's what you're normally going to see. Obviously, if you have any questions at any time about the ventilator or your patient and their settings, please contact your respiratory therapist. We're always happy to help and answer any of those questions you may have. Thank you for watching.